Lipkin. Now, there's a lot happening in 2020, and this is just a reminder that this month, October, is Breast Cancer Awareness Month, and we want to make sure that you know how to arm yourselves against breast cancer. That includes the importance of a mammogram screening. And yes, even during a pandemic, it's very important to keep on top of that. Today is actually National Mammography Day. So we're going to be bringing in Dr. Erika Hamilton, the director of Sarah Cannon's Breast Cancer Research Program. And first, thank you so much for taking the time to be here, Dr. Erika. What can women do to arm themselves against breast cancer, including the importance of screenings, even during the pandemic?
Absolutely. So it's vital to do screening. Screening helps us catch cancers earlier when the chance of cure is higher. If we catch a breast cancer early, survival is over 95%. So here at Sarah Cannon, we recommend monthly breast exams starting at age 20, age 20 to 40 monthly breast exam, and a yearly breast exam by your physician, and over the age of 40, a mammogram and a breast exam by your physician annually.
Now, if breast cancer is caught early, like you said, 95% survival rate. Now, what should women actually be looking for in self-exams?
It's a great question. So it's not just a lump. A lot of people think that cancer is always going to be a lump. Oftentimes it is, but it can be redness to the skin. It can be dimpling. It can be retraction of your nipple. Any change to your breast, and knowing your body is very important, is something that you should talk to your physician about.
You know, I actually had a scare not that long ago, and I went in because I know I'm young, so I was about 29 at the time. And what I found really interesting is I wasn't sure what a lump actually felt like, but they had something that I could touch there, and I remember feeling, and it kind of felt like, you know, the nerd candy. It's a very, very small, but very kind of tight ball is kind of what you're looking for sometimes as well. Not necessarily bigger lumps, because that wouldn't necessarily be cancer. That's usually like your lymph nodes, right?
Absolutely. Sometimes cancer can be bigger. So really any change from what your breasts normally feel like is something to ask the question to your physician about.
Now, what about COVID-19 concerns in hospitals? You can obviously wear a mask during a screening, right?
Absolutely. So we now know that based over year insurance claims that hundreds of thousands of cancer screenings were deferred due to COVID. This year already, we're seeing a decrease in diagnoses of breast cancer up to 50%. And unfortunately, this isn't that cancer is going away. It's that we're not picking up these cancers when they're early. So this is really worrisome and underscores the importance of getting the mammograms and the downstream effects of coronavirus well beyond effects of COVID-19 hospitalizations. So we're already seeing increase in more advanced cancer. So if there's anything you can take away for this, it's don't defer your cancer screening.
Sure, and breast cancer does not see gender. It affects everyone, both men and women, right?
It absolutely does. And as you mentioned, we've been dealing with this for 6-7 months now. Our mammogram facilities are well equipped to keep you safe, even with COVID-19. And like you say, you can wear a mask throughout your entire mammogram. It won't affect the images and doesn't affect positioning.
Now, what are other important takeaways that you want our audience to have today on National Mammography Day?
I think another important takeaway is just that 1 in 8 women will have breast cancer at some point over their lifetime. So I hear a lot of people say, well, breast cancer doesn't run in my family, so that's not something I need to worry about. Only the vast minority, a very small percentage of breast cancers are really genetically linked. It's most patients that don't have a bunch of cancer in their family. So don't let that fool you into thinking that you don't need to stay up to date on your mammogram or that breast cancer couldn't affect you.
Thank you so much for your time and your insight, Dr. Erika. Again, you are the director of Sarah Cannon's Breast Cancer Research Institute, and we appreciate you giving us insight on NBCLX.
Thank you so much for having me.